Hi there, my name's Andrew. I am the RN case manager for Mr. Roberto Piñon. He is a 82-year-old male with a history of COPD, hypertension, and Parkinson's, who was recently discharged from transitional care, and prior to that was in the hospital for community-acquired pneumonia. Um, I'm calling for a follow-up to the provider here. Um, and I'm trying to refer him to home health services to assist with his medical management, his wound care, not his wound care, but his rehabilitation to back at home, and the medications that he needs that he's struggling to take, as well as the burden on his wife that's been developing over time that he needs to um, manage to help with assisting in care. So home health services would be excellent for him to relieve that pressure off of his home care strain of his wife. Um, I did an initial home visit to assess his needs and develop a plan of care. Um, we see that his wife works heavily to assist him, and how he's had struggles with doing activities of daily living. He has not been able to uh, get out of the house as much and been able to cook his own meals, and his wife does all of that and supports him through that. He's having trouble moving around and getting up, so supporting his activities of daily living would be huge. Some assessments I saw his respiratory status has improved since discharge. He I did vitals on him that were his normal blood pressure, even though he has hypertension. He is unable to leave his home for long periods, and he wants to start driving again, which I wouldn't recommend for his condition if he's not able to get around and cook meals. He's got ongoing needs for education on medication management and rehabilitation to support his respiratory needs at home using his inhalers or his nebulizer or whatever he needs, but resources he does need. He does require ongoing nursing, I think, with a home care aide to provide those services and to help him, get through and manage his chronic conditions. He will need, community services, supplies, and equipment that I, identified during the assessment. So recommendations that I would do would be providing ongoing home care services to Mr. Piñon. I would refer him to community resources to support his chronic health conditions and prevent hospital readmission or long-term care readmission or long-term care admission. And I'd recommend a care conference to discuss options to address his chronic health needs and to support him throughout his care.